we are going to go on with this new guest. Her name is Kathy, and how are you?
I'm fine. How are you?
Okay. Listen, I think that everybody wants to hear your story in your own word of what's your cancer experience and what happened to you.
Okay. All right. I was diagnosed with globular carcinoma, stage 2, and it was in my left breast. They did biopsies and confirmed it was carcinoma. And my doctor sent me to a surgeon who recommended double mastectomies, the lymph nodes being removed, chemotherapy, and radiation. And I chose not to do that for a couple reasons. The week before I was diagnosed, I lost a friend who had breast cancer. She had surgery, she had the mastectomies, and she started on chemo on Monday, and she died on Saturday as a result of the reaction to chemotherapy. I have been a person that's always had severe allergies to medicines, penicillin, erythromycin, and I just felt that if I did any type of chemotherapy, it would kill me. So I decided that I wanted to find another alternative to having this breast cancer treated. So I did some research on the internet, and I did go to Ohio, and I had the tumor treated with cryoablation. I had that done in 2008. About 4 months after I had it treated, I started to get a large lymph node under the armpit, which got sore and continued to grow, and when I researched it, they couldn't treat the lymph node with cryoablation. Anyway, I had a couple biopsies done, which confirmed that I still had cancer in the breast, in that tumor, and in the lymph node. And a friend of mine sent me some information about Dr. Carpenter's Lase therapy. So I did call and talk to her, and I went down there, and I had the treatment. I would like to mention, too, that I also had a small spot in my right breast that they put a titanium chip in. They had a lot of trouble getting a good biopsy out of it. But when I had a PET scan prior to going down to Dr. Carpenter's, there was a small area, a real small area lighting up on that PET scan. So when I went to see Dr. Carpenter, she treated the tumor in my left breast, the lymph node in the left armpit, and the right breast. And that was in November of 2009. I then went back for a follow-up in March of this year, and Dr. Carpenter said everything was fine. In your mind, once you've had cancer, if you get any swelling or you get a pain somewhere, in the back of your mind you're thinking, oh my God, is this cancer, is it spreading? So I did go for another follow-up check and had PET scans done in June of this year, which showed that there's no cancer being spread. There is some inflammation on the left side where I still have that little tumor that the body's trying to get rid of. And the lymph node that was it was between a large egg and a tennis ball size when I first went down to see Dr. Carpenter, is now about the size of, a medium-sized grape. But the doctor who is head of the oncology department in the town I live in was so impressed with the PET scan, he also ran all kinds of cancer analysis tests on me because he wanted to see what was going on. And when I went back for my follow-up, he said, I cannot believe after 3 years your cancer hasn't metastasized, there's no more cancer, and your cancer analysis tests are showing that there's no cancer in your body. And he said, I cannot believe that. He said, you are so lucky. So I did tell him that what I was looking for, I would like to maybe someday have that tumor in the breast taken out if it doesn't totally dissolve. But I've been doing what Dr. Carpenter recommended, take taking the serapeptase. So another thing I noticed was that when I went down and had the treatment with Dr. Carpenter, you're a little sore from the treatment, but it was like an energy boost. 2 weeks after I had that done, I got so much energy, and I don't know, I feel like I got younger, probably 20 years younger. Before she treated me, I had trouble with joint pains and walking and going up and down steps. You know, I'd be a little sore at times. Now I can run 3 miles a day, no problem. So in addition to feeling good that the cancer was cured, I don't know if that was caused by the stress being taken off my body, but the energy, it was like being born again. And still to this day, I mean, I feel great. I've lost weight, maybe like a pound a month, probably because I can be so much more active and I feel so good. But I will say that I have had quite a few friends that were diagnosed with breast cancer, and they chose to go the conventional route. Mastectomies, chemotherapy, radiation. Unfortunately, they're not alive anymore. And one of those was not even 40 years old and left behind 2 little kids. I get kind of emotional talking about it.
I know.
And, sometimes it's hard to talk to people because they do what their doctors recommend, which is the conventional therapy. And I have even had, I've called a lot of doctors trying to look for alternative treatments. And, a couple of them said, we don't know if that's the right way to go, but, the mastectomies, radiation, chemotherapy, that's what the standard protocol is, and that's what we have to follow. So.
Yeah, which doesn't make any sense.
No,
it doesn't.
It doesn't make any sense.
The results are... No, because the results are so bad. Why would they have to stick to that? But also, do you want to discuss what happens when you're trying to get the lump removed, the dead tissue removed?
Yeah, I've gone to several different cancer centers. The last one I told you about, I had better results. That doctor did do the PET scan because he was convinced that I would have more cancer, and he said, well, I just want to stage it, and he was shocked when it hadn't spread, and like I said, he then ran the cancer analysis tests, which were also negative, and he was extremely impressed. But when I've scheduled appointments to talk to surgeons about possibly removing the lump, they either want to do a total mastectomy with the surrounding lymph nodes, or they want to do double mastectomies, and they want you to follow up with chemotherapy and radiation, or at a minimum, at least do the radiation.
Why, if you don't have a sign of cancer anywhere?
I have no idea. I truthfully think that I think it's because of the money they make.
I don't know, but it doesn't make any sense.
I know, it doesn't make any sense. I even have another friend who was diagnosed with lung cancer, and she had chemotherapy and radiation 4 or 5 months ago. Now she's got breast cancer, and I'm sure that's because she said her chemo treatments cost $25,000 each. And, you can imagine what that would cost if you went every day for 6 or 8 weeks. I think that's part of maybe the justification, part of the income. I don't know.
But that's terrible because it's supposed to be service to the public.
It is supposed to be service to the public.
It is, and it's supposed to do the best for the individual, and it's not to butcher them, poison them. We got a break coming. We're going to continue. Don't go away. We're going to continue.
Thanks.
Okay, we're back from the commercial break, and we still have Kathy here. And what I like to have her tell you is that, she does have immune system surges. It's just how she reacts to those. She knows what they mean. I want her to tell you. Okay, go ahead, Kathy.
Yeah. After the treatment, I would say probably around 4 months after the treatment, I got other lymph nodes that popped up, and they were sore, both on the left and right side. And, of course, you start thinking, oh, you know, is this cancer spreading? And then you remember, no, Dr. Carpenter told me that that's going to happen. And it did happen. I would say probably 3 or 4 times I've had those. They last anywhere from a couple days to a week, and then they go away. Each time, like the lymph node under my armpit, there might be 3 or 4 smaller lymph nodes, but the big one that was so big shrunk. And so I thought, well, maybe that, you know, that is my body working to get rid of this.